Hey everyone, I wanted to share a Teal Tuesday tip because I got quite a few DMs the last time I shared a tip about pretty much the same question. A lot of people want to know what the difference between a papsmear and a transvaginal ultrasound is. And it's a very simple difference. The papsmear is like a long Q-tip that they insert in your vagina, and they're checking your cervix to make sure there's no abnormalities. Whereas a transvaginal ultrasound is a device they put in your vagina to really check your entire gynecological system. It checks your ovaries, it checks your uterus, it checks your cervix to make sure that there's no abnormalities or growths. You might have cysts or things like that. So the in standard practice, you're being checked by the pap smear, but if there's anything that they have a concern about, they test you with the transvaginal ultrasound. So my advice to you is, if you have any concerns or are there any abnormalities or things you're noticing consistently, share it with your doctor so they can give you a thing people DM me about was sharing in my Insta story the question bar so that you guys can continue to ask me questions. I'm obviously not a medical doctor, so I can't answer all the questions for you, but I can ask my doctors who are really good about answering questions, and I have other nurses and people in my life that could help answer questions. And I'm obviously doing a lot of research and taking classes and things myself to be as knowledgeable as possible on gynecological and women's cancers so that I can share the information with you all. It is so important that you just communicate with your doctors and listen to your body. Please follow me on my website, www.nowiamnia.org, if you want to continue to learn more. But feel free to contact me in my DMs on all social media platforms at nowiamnia. And that's it.
Tell us why this test is so important for women.
It's a way that we can actually look at the uterus, look at the ovaries, and make diagnostic decisions about what's going on with a woman. If she has ovarian cysts that need something done about them, or they're benign, or that they're potentially maybe cancerous, or that she has a thickened uterine lining that may need a DNC or an endometrial biopsy. So it gives us a lot more information than just the pelvic exam that we do in the office.
And Fran, you're passionate about this test yourself.
Yes, we've actually started legislation here in the state of California to try and make the TVU, the transvaginal ultrasound, like a part of every woman's annual gynecologic exam. Most women don't realize that when we get the pap test, that doesn't cover anything north of the cervix. And when the doctor says your pap test came back normal, they think, okay, well then I'm normal. But there really hasn't been a lot of diagnostic attention being paid to the uterus and the ovaries. And that's something that we think should be changed.
We wanted to let women everywhere know what this test means. So Lisa, take it away and talk to us a little bit about what you're doing while you're doing it.
And Fran's absolutely right. This gives us an extra pair of eyes. And right now, see, when we get right into the vaginal canal, you can see the bladder. Anything that is black is fluid on the ultrasound. And right underneath the bladder, and she has a very full bladder, sorry, Kristen, she's being a good sport, is the uterus. And the uterus is this nice oval shape here that you see. This bright white, and here is the lining of the uterus, and her uterus looks really nice. She has a little degenerating fibroid here. That just means that it's kind of almost curing itself by just collapsing on itself, and fibroids are benign. This is her left ovary, and she actually has a cyst on her left ovary. Remember again that any black on the ultrasound is fluid, and she has a cyst here, and it looks like it's about 1 centimeter. Which isn't, on the ultrasound, it looks large. This is the ovary right here. It's this almond-shaped thing. And again, on the ultrasound, it looks really large. This is the ovarian tissue, and this is the cyst. And this cyst looks pretty good, okay? The things that you worry about with an abnormal cyst is if it has septations, meaning little markings right in the middle of the cyst, if it has excrescences or solid things floating around in there, if it has a ground glass appearance, which might be an endometrioma, which is again benign. But this looks like a common cyst that a woman gets every month during her cycle. The egg bursts out when she ovulates. And where are you in your cycle right now?
About midway.
About midway. So we would expect to actually see a cyst on her ovary. So this can be completely normal, all right?
And Dr. Lisa, who would be an ideal candidate for this test?
Somebody who's had a family history of ovarian or breast cancer, because remember they're connected. Someone who's had cysts before that may have been benign, like dermoid cysts or other cysts that might come back. So that's very important to have. Somebody who's had irregular bleeding, or someone who has pelvic pain. because this is one way, because if you have a really large cyst, that's another thing to worry about because it can twist, and that can be an emergency. All this took, minutes here, and this can be done in the office. It gives us some eyes on the pelvic exam, which is just the hands. We can feel a lot on the pelvic exam, but we can't see, and this makes it, much more accurate.